Hi, my name is Ajay Kumar and I'm going to share with you some of the results of our approach using diffuse reflectance spectroscopy based blood oxygenation monitoring, a prospective study for early diagnosis of diabetic foot. The outline of this presentation, we will start with the introduction followed by motivation, then we will discuss about the diffuse reflectance spectroscopy, data analysis, experimental setup, results and discussion, then we conclude and also discuss the future work. Diabetes is a major health issue. According to IDF report, in 2019, 463 million people were affected with diabetes, which will be expected to increase 578 million by 2030 and 700 million by 2045. That is, there is 51% rise in the diabetes cases. Because of the diabetes, people are at high risk of developing a number of health complications like mental stroke problem, retinopathy, dental problem, cardiovascular diseases, nephropathy, pregnancy complication, and diabetic foot. Among all these complications, diabetic foot is one of the most common leading cause of hospitalization and lower limb amputation. According to IDF, every 30 seconds, a lower limb is lost somewhere in the world. Let us consider this healthcare versus quality of life figure. As you can see from this figure, if diabetic foot ulcer is not diagnosed at an early stage, then this results in the foot infection, which leads to the lower limb amputation. So this will increase the healthcare cost and decrease the quality of life. What is the pathophysiology of diabetic foot ulcer? Because of the diabetes, both nerves and blood vessels of the foot are damaged and become stiffer. This causes the ischemia, a condition in which blood circulation in the capillary is restricted and the availability of oxygen to the tissue is reduced, which will lead to the diabetic foot ulceration. The current diagnosis method are medical history and physical examination, imaging modalities, and laboratory tests. However, these methods have some limitations like sophisticated equipment, they require specialized expertise, not user-friendly, and some are expensive and not able to provide localized information of blood oxygenation. Therefore, there is a need of a method which is simple, easy to use, cost-effective, and provide real-time and accurate localized blood oxygenation state of diabetic foot ulcer. Diffuse reflectance spectroscopy could be the best option because of its advantages like non-invasive, real-time and accurate monitoring, easy to apply, and have ability to characterize the normal and malignant states of different type of tissue. Now, what is diffuse reflectance? This is nothing but the single and multiple backscattering of excitation of light. As we know, human skin has three layers: epidermis, dermis, and subcutaneous. When light is incident on the skin surface, some part of light will be reflected from the surface, which is our spectral reflection. Some part will be absorbed, and some part will be scattered and coming out of the surface, which is our diffuse reflectance. Thus, diffuse reflectance is a function of the wavelength of light, which is further the function of the absorption and scattering coefficient. In the visible region, hemoglobin and melanin are the major absorber of light. So let's have a look on this wavelength versus absorption coefficient diagram. As we move from ultraviolet to visible region, the melanin absorption goes on decreasing and it becomes nearly stabilized in the NIR region. The hemoglobin absorption is mainly due to reduced hemoglobin and oxyhemoglobin. The oxyhemoglobin absorption occur at 542 nanometer and 577 nanometer, which is our alpha and beta band, and reduced hemoglobin absorption occur at 555 nanometer. Up to now, we have discussed that diffuse reflectance is a function of wavelength of light, which is a function of absorption coefficient and scattering coefficient, as we want to calculate two constants, reduced hemoglobin and oxyhemoglobin. But we have one system of equations with two variables. Therefore, the solution of these equations become very complex. So in order to avoid that, we have selected the three adjacent wavelengths and substitute in this equation. And after solving these equations, the reduced hemoglobin and oxyhemoglobin are obtained, which are given by in these equations. One can get oxygen saturation by using these equations. We have selected 618, 628 and 638 nanometer for our data analysis. We have used bifurcated fiber probe for this study. This fiber probe has 6 illumination and 1 collection fiber, and all are 200 micron multimode fibers. The white light from this halogen light source is guided through this fiber to illuminate the measurement sites, and the diffuse reflectance from the measurement site is detected by the collection fiber and is guided through this fiber to the spectrometer. The diffuse reflectance detected by the spectrometer is displayed on the monitoring system, as you can see from this figure. The measurement sites for this study are great toe, ball of great joint, fifth metatarsal, and calcaneum of the human foot sole. The reason for choosing these sites is that these are the most susceptible sites for foot ulcer. This may be due to the greater pressure exerted on these sites during standing and walking process. In this study, we have fixed the distance between the bifurcated fiber and the measurement sites. So how we fix it? So we connect the ferrule of the fiber with this body spacer, which is fixed in the homemade center, as you can see from this figure. We got the ethical clearance from Institutional Ethical Committee, Chandigarh, for this study. In this study, we have selected the 3 male subjects. This is the wavelength versus normalized diffuse reflectance spectra of great toe, ball of great joint, fifth metatarsal, and calcaneum of the foot sole of subject 1. As the diffuse reflectance is measured in the visible region, therefore attenuation due to hemoglobin absorption at 542 nanometer and 577 nanometer are present in each spectra, as you can see from this figure. However, this spectra is more attenuated in great toe, followed by ball of great joint, then fifth metatarsal, then calcaneum. Literature reported that the average hemoglobin concentration found to be highest in great toe, followed by ball of great joint, then fifth metatarsal, then calcaneum. Therefore, attenuation due to hemoglobin absorption follow this trend, and our measured trends are in agreement. A similar trend is observed with other subjects also. This is the comparative stack plot of localized volume fraction of reduced hemoglobin, oxyhemoglobin, and oxygen saturation in an arbitrary unit calculated from the measured diffuse reflectance from great toe, ball of great joint, fifth metatarsal, and calcaneum of the foot sole of subject 1. As you can see from figure A and figure B, the volume fraction of reduced hemoglobin and oxyhemoglobin on each side follow the relative trend. It means the volume fraction of reduced hemoglobin, let's say, is highest for any spectra of a great toe, then volume fraction of oxyhemoglobin for the same spectra of a great toe is low. This may be due to systolic and diastolic blood pressure from the pumping and relaxation of the heart. And similar trend is observed with the oxygen saturation. Diffuse reflectance spectroscopy based approach can be used for blood oxygenation parameter monitoring from the foot sole of human subject. Our obtained diffuse reflectance spectra followed this trend. We found the average level of reduced hemoglobin and oxyhemoglobin followed the reverse trend. In conclusion, with our approach, we have quantitatively find out the localized blood volume fraction of reduced hemoglobin, oxyhemoglobin, and oxygen saturation from the site of human foot sole. Therefore, diffuse reflectance spectroscopy based approach may be used as a diagnostic tool for early diagnosis of diabetic foot ulcer, which may reduce the healthcare cost and improve the quality of life of the diabetic foot patient. But for this, further study with more subjects and patients will be needed. I would like to acknowledge Director CSR CSIO Chandigarh, DST Serve for funding this study, our project collaborator Dr. Rajesh Kanavade from India, Dr. Olia from Indonesia, and Dr. Kilayavani Chelapan from Malaysia. I would also like to acknowledge all the members of Advanced Material and Sensor Division, CSI CSIO Chandigarh. With this, I would like to thank you for your kind attentions and I am looking forward to your questions.